So one of the things that really separates economics from all other disciplines is our recognition of what we could call unintended consequences. Briefly, an unintended consequence is a consequence of, in this case, a policy that was not the intent of the policy itself. So for example, policies which are designed to help people, occasionally, when they're implemented, end up causing more harm than good. So let's go through a couple examples and see if we can figure out what some of the unintended consequences might be as it pertains to healthcare. So in a previous video, I mentioned that in my personal opinion, the price of healthcare is far too high and the availability of healthcare is far too low. And I mentioned that one way to solve this problem, or to resolve this problem, would be to find a way to increase the supply, to make it easier for medical professionals to provide healthcare to more people. Other people seem to think that what we could do instead is just mandate a lower price. After all, if the price is too high, wouldn't it make sense to just say the price has to be lower? And we can sign that bill into law pretty easily. So if we did something like that, remember, that will not affect either the demand curve or the supply curve. The demand and the supply curves are affected by non-price changes. And here, all we have is a decrease in the price. So what we would see is the price go down, right? Because we can't deny that if we set a price lower, I'll call it PL, what we would find is that this maximum price would be about here, let's say, okay? And in economics, we would call this a price ceiling, okay? At this lower price, the amount of healthcare that is desired or that we wish to purchase would be some number out here, so it would increase. And that makes sense because at lower prices, consumers wish to purchase more of something. But what we also see is this point here, which would be the quantity supplied. So this would be the amount of healthcare that is actually provided to what we could call the market or to society. So this is a problem because in this case, the quantity demanded is greater than the quantity supplied. In other words, people want more healthcare than actually exists. So what will be the result of this? Well, we can think of a couple different scenarios. One would be a really long line at the hospital or at the doctor's office. So to get an appointment, it might take months or perhaps even years to get an actual appointment with your doctor. We could also see changes in how people decide to pay their doctors. So for example, you could pay them money for the actual appointment and the care that you receive, and you'd pay them, this many dollars for that. But you could also give them special gifts. And this is something that we see in other countries all over the world. In China, for example, it's common to give the medical professionals or the doctors in your neighborhood a gift in order to make sure that your family actually gets to be in the front of the line for medical care. We could also see doctors, instead of charging a small fee for this, we could see increases in perhaps the price of parking in the parking lots. We could see diminished quality of the wait rooms. We could also see doctors rushing to get through as many patients as possible and spending far less time per patient. So this would be a situation where rather than see the doctor, you would actually see a technician, a nurse, or someone else who could effectively do the same work as the doctor, but you wouldn't get to speak to your actual doctor. And so the price ceiling approach might lower the price of medical care, but it's not going to necessarily increase the quantity unless something else changes in the way doctors provide their health care. Maybe instead of using a price ceiling, what if we instead used a subsidy? A subsidy is the same thing as a negative tax. So we can use the wedge method if we want to think of it this way, the same way we did for the tax, but this time it's going to be coming from the other side. So a subsidy, in effect, lowers the price that consumers pay and increases the amount of money that producers receive. Okay, so for example, if the price of medical care was $30 and you had a $10 subsidy, you, as the consumer of medical care, would pay $20 out of your pocket, the government would chip in another $10, and the hospital or the doctor's office would receive a total of $30. So the doctor receives $30 and you only pay $10. So what we can think about is a wedge being over here on the right-hand side. And this wedge, we'll call this Q subsidy, would be equal to the amount of the subsidy. And this price over here, this would be the price that the sellers receive, and this would be the price that the buyers actually pay. Okay? Now, what's wrong with this picture? Well, what we have here is the exact same thing that we had over on the tax side. We have this deadweight loss. Okay? But instead of it being a deadweight loss in terms of lost exchanges due to the tax, this is actually an excess of exchanges that only exists because of the subsidy. And so what we end up seeing would be more medical professionals entering into the medical field only because of the subsidy. But remember, people have opportunity costs. And so anyone who enters the medical field because of the subsidy would be someone who did not enter a different field somewhere else. And so what this means is that we would have more health care available, but we would have less of everything else, or specifically the things that those people would have done had they not gone to medical school. We also get trapped in a world where what if the subsidy goes away? What would happen to these medical professionals who, again, only entered the market because of the subsidy? Well, they would find it very difficult because they would have a ton of specialized training, or what we could call asset-specific capital or asset-specific human knowledge. And so what we would see is they would have a lot of skill, but very few people to actually meet and practice their skills on. This could cause serious problems down the road, in addition to costing taxpayers money, because these subsidy dollars have to come from somewhere. They have to come from some place that can't just be thin air. Instead of coming from thin air, which it would be great if they could, they must come from taxpayers. So the subsidy must be paid for by a tax in some other industry, which means not only will we have this deadweight loss triangle to worry about, but we'll have other deadweight loss triangles as well.